Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during the forum, email them to pembrokeinfo@pactv.org. Again, questions can be emailed in at pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants who are contributing today. Welcome, Sabrina.
Thank you, Julie. Good morning to you. Today, Pembroke Emergency Management is presenting really smart folks to come and answer the questions that everybody's been sending in. And we want to thank people for that. And today with the COVID-19 update is Lieutenant Richard MacDonald, Health Agent Lisa Cullity, Selectman Dan Trabucco, and Deputy Chief Ken McCormick from the Fire Department. Good morning, everyone.
Morning.
Good morning, Sabrina.
Good morning,
Thank
Sabrina.
you. Thank you very much. To start off today, we have about a dozen frequently asked questions. They're coming in from folks who are home wanting to have some answers, just learning about this forum. So there's a lot of folks tuned in today to find out the answer to some of their questions. To start off, Lisa, what is the most recent Department of Public Health report for cases in Pembroke?
So currently we have 8 positive cases in Pembroke. We do expect that number to climb significantly as the testing is increasing. We know we have several more suspect cases. I would not be surprised to see several more cases become positive today.
Thank you. All right. Deputy, people are home right now with allergy and flu-like symptoms. Pretty standard things for April in the season. But the question now becomes, what are the defining symptoms that should have me really taking a look at my health and making some decisions? What is the difference between your run-of-the-mill seasonal allergy, hay fever, and some of the symptoms you're hearing reported regarding COVID-19?
So hopefully people that actually have allergies to kind of know the signs and symptoms, but we're looking fever is number one. In allergy season, you're not going to get a fever or a prolonged fever. Allergies are going to give you, it's going to be sinus and above, it's not respiratory and below. So those are some of the things you're looking for. Difficult breathing usually doesn't come with allergies. It's usually, head cold, head sinus issues. So those are the things you're kind of looking for. But by all means, if there's any issue or problem, have them give us a call. We'll come take a look. There's a protocol that we go through now for transport and non-transport, so we should be able to help them out.
And as a follow-up to that, how would someone get tested for COVID-19 if they felt that their symptoms might rise to the level of being tested?
So currently, there is no just drive up and get tested. You need to for your primary care physician, telling him the signs and symptoms. The only way that actually works is if you have the signs and symptoms, we take you to the hospital, they'll test you. But just to go get tested, you go through your primary care, tell him what your signs and symptoms are. They then will give you a location. Some are probably within their network, so that they're going to send you to where they want to send you. And then they just might have 2 or 3 locations that are set up to do testing. But if you drive up to a testing facility without permission per se, or a doctor's note, they're probably not going to test you.
Okay, so following that, Lieutenant, someone at home calls 911. They have enough significant concern that they want to reach out and either be evaluated or share their concerns. What actually happens when someone calls 911? Who answers that call?
We, the police, answer the call. And like in the past, we filter the call to ask certain questions to see if it is an emergency. And if it is, we'll pass it on to the fire department. We get a lot of calls that are not really 911 calls, and we'll refer them to our business line.
All right, so you receive that call. What kind of things do you want to hear someone volunteer to you in that call? What would be helpful to the department?
Well, if they have flu-like symptoms, if they've been in contact with anybody outside the United States, along with anybody that had been impacted by COVID, And if they have any of the symptoms of the breathing issues and things that come with it, along with the temperature.
And just to follow that up, what would you then recommend for them before you send someone out?
Well, just basically stand by, don't get excited, relax. Sometimes we stay on the line until the fire department gets there to keep them in a relaxed mode, and essentially wait for the FD to get there.
And there's not been any problem with response in terms of the department is ready to go and ready to roll no matter what that call is, correct?
Yes, it's always been good.
Good. Excellent. Thank you. Lisa, quick question. What is the position on masks? You have masks yes, masks no.
But masks are never a bad thing. Masks obviously will prevent someone from inadvertently sneezing, coughing, or expelling droplets out into the atmosphere. So that's never a bad thing. And to a certain degree, if someone were to cough right next to you or on you, God forbid, it would add a layer of protection. Obviously, medical masks are the only thing that protect you truly from being around consistently someone that is affected with COVID, but no one should really be in that position unless, of course, someone in their home has it. So masks are never a bad idea. It's not yet necessarily an advisor yet. It just is. Good idea.
Got it. Selectman Trabucco, a very important member of the emergency management team is the town manager. Can you give everybody an update on where Pembroke is in the process of recruiting and procuring the town manager role for the town of Pembroke?
Right. So the Board of Selectmen have selected William Chenard as the next town manager. The Board of Selectmen have offered him an employment contract, and we expect him to sign in. The Board of Selectmen to countersign it as early as this Tuesday meeting. Now, he is already committed to joining the town of Pembroke in the seat, ready to go on May 11th, which is the day after Ed Thorne retires. So we have a plan in place to transition from the current town manager to the new town manager with no interruption. And in fact, the new town manager is going to try to join the town of Pembroke a couple of days early to just meet and greet unofficially off the clock, so that when he does finally join us full time on May 11th, he'll be ready to go. And he's currently the assistant town administrator to the town of Natick, but their administrator has been ill lately, unrelated to COVID. So Mr. Chenard has been in the hot seat in the town of Natick. So he will be ready to join the town of Pembroke with full knowledge of all the emergency management processes from his town that will translate, I'm sure, readily to this town, especially with the fine staff that we have in emergency management here.
Perfect. Thank you very much. That's good news. Lisa, quick question for you.
Yes, ma'am.
Procedurally, I am concerned that I may have the virus. I am tested and I receive a positive test. What steps happen at that point? And will the results of my test be shared? Will I be cut off from services? Can you tell us a little bit about that?
Sure. So anyone who tests positive for COVID is either going to hear back from their primary care physician or whatever physician would have ordered that test for them. Unfortunately, that of course is bad news, and it comes with some restrictions. So after you are made aware you're positive, and you could possibly also be made aware that you're positive by a public health nurse. And again, I've told everyone about the system that we use to track this. The system is called Maven. This system is not open to the public at large. Matter of fact, it's not open to anyone who isn't a public health nurse or an immediate care physician of people with an infectious disease. Those are the only people that see that information. You're going to receive that phone call. But in addition to that is when the public health nurse does call you, you are also going to get a set of instructions. This person is an RN. They're going to give you instructions on what you can and can't do. They're going to give you instructions on how to receive food. The hope is that most people have some sort of family or infrastructure that could drop off food to them, drop off medical supplies to them. If not, we do have a system within the community to help backfill some of those people that maybe don't have a resource near them to get that kind of help and assistance. And you would be given a set of instructions. So the first thing that's going to happen if you are COVID positive is you are going to be quarantined to your home for 14 days. There is no exception to that. You can't go out for any reason. The only reason you would leave your home is, God forbid, if you really had trouble breathing and you were to call 911 and be like, I can't breathe, I'm really struggling, it's a problem. And in that case, you would leave by ambulance. It is important when calling 911 if you are having trouble breathing and if you are positive to make sure that information is known to the first responders so you don't inadvertently infect them. So under that quarantine, you're going to hopefully just experience the mild flu-like symptoms that most people seem to recover from just fine on their own. You're going to need to stay in your house. Hopefully, if again, a friend or a neighbor, a relative can do some grocery shopping. You don't want to be interacting with them. You want to message them or ask them. And if you do not have those resources, you should tell the public health nurse so that she can make sure the town's aware so that we make sure we can offer you some of those services. No medical information at any time of any kind is shared. Let me say that again. I know a lot of people want to know who's sick, where are they, where they've been. That information is very strictly protected and that is never going to be shared with the public. So you're going to follow your 14-day protocol, and with any luck and just a little bit of perseverance on your part, you're going to recover from COVID just fine. And after 14 days, you will not be able to infect people, and you're going to be able to go about living your life. That is the optimal outcome for everybody, should you unfortunately contract this.
All right, Lisa, that leads to another question that we've received. What does a caregiver do, or what does the person themselves infected with the virus do with any of the cleaning supplies and all of the byproduct that just come with living in your home for 14 days? Is there any special disposal methodology or anything that you've heard at this point to separate out and get rid of anything that's come in contact with a positive patient?
When you're positive, anything that you're going to be touching and disposing of has the potential to carry the virus. The public health nurses will go over all those protocols with you. But good common sense tells us, of course, you're going to want to make sure those things are bundled up, tied tightly in a nice plastic bag, which is already required in Pembroke for all your trash. For those that aren't aware, none of your trash should be loose in your trash barrel ever. Chances are very good the nurse is going to instruct you not to continue to recycle because that's loose at this point in time. They're probably going to instruct you to put all of those items again into a trash bag tied up tightly. Now, the one wonderful thing that Pembroke has, which a lot of communities have, but we're really lucky to have it at this time, is of course full automated trash pickup, which means there is no requirement for another human being to touch your trash. But if any of these protocols are updated or changed, the public health nurse is going to be able to go over that with you at the time that you are notified that you're a positive.
All right. Question for the lieutenant. Thank you, Lisa.
You're welcome.
People are calling in with reports of folks congregating, getting together outside of the stay-at-home advisory that the governor's issued and that PEMA has implemented. What should they be doing when they see these people? There's a lot of feeling that they should be telling someone. They should be alerting someone to that fact.
Like anything else, we'll actually go to wherever that call is made and address the issue to whoever it is. A lot of times it's family members that live in the same household. Either way, it's a conversation.
Very good. Very good. And would they call the non-emergency line, the business line to the police department if they had that concern?
Yes, that's not a 911 call.
Okay, good. And that's 781-293-6363?
Yes.
Excellent. All right. So how are you guys staying safe out there when you go out on these calls, sir? What do you, how are you handling approaching crowds of people and having that conversation?
The social distancing, keeping 6 feet away, having conversations from, if we're at the door of a house, we'll knock on the door and step back and have that 6 feet. And everybody's kind of doing that. The education's out there. It's not a stranger to us. And we're just people. So we practice the same thing.
Very good. Now, there was a need to close the recycling center, Lisa.
Yes, ma'am.
Emergency management team talked about this on Monday morning.
Yes.
What was observed on Saturday when folks got down there to dispose of their items?
Unfortunately, I'd like to think people either were just not aware or very busy getting rid of their items. But unfortunately, the volume of people that came through the recycling center at one time, the number of people congregating at the recycling center, and unfortunately, the lack of observed social distancing by the limited staff that was available at the recycling center It's just not safe to keep it open. Obviously, we know everyone's doing a lot of yard work. We know people are doing a lot of clean outs. But then going to the recycling center and being all bunched up around the leaf pile, the metal pile, being close to each other, emptying things, that's not safe. And the town certainly can't continue to promote and allow an activity to go on that's not safe. It would have been nice if people had stretched it out a little bit. I think part of it was the excellent weather. So just so many people were out doing that, which fed into it. But obviously we cannot have people congregating in a town sanctioned environment or activity, whatever you want to classify it as, that puts people at risk. So unfortunately, at this time, we have no choice but to close that down to prevent people from being within 6 feet of each other, to prevent people from congregating, especially people outside their household units.
And Selectman Trabucco, there was discussion about extending and offering additional services once this period has lifted. Would the selectmen support that endeavor by the emergency management team and the town to have extended access a bit when we first come out of the stay-at-home advisory, just so people can catch up to help try to mitigate some of the experiences that they're missing right now?
In terms of the recycling center,
Yes, we're having some recycling center and brush pit questions, and right now, opening them seem to be problematic for the team. So the questions become, if we were able to offer it on the back end, if folks had additional access when this is over, that could really help them, knowing that there's a plan in place. And
sure.
I know that there was some loose discussion of it Tuesday at 3:00, and just wanted to see if you could weigh in.
Right. So the selectmen have discussed it, and we left it up to the town manager and the emergency management folks to determine if we can open at least the brush portion. And then the secondary part of that is, can we open the Monroe Street pit for brush drop off? So I think, I haven't heard back from them officially if we're going to do that, but the town of Pembroke, Board of Selectmen, along with the emergency management team, Board of Health, will certainly consider opening the recycling center, or at least the brush pit in Monroe, where you can socially distance when you're dropping off brush. We're going to be as helpful as we can to the folks after this is done.
And the selectmen work with PEMA to make these decisions. That's right.
Exactly right. The Board of Selectmen rely on PEMA, and if PEMA needs a political decision or an administrative action from the Board of Selectmen, we'll be there to help. But we do rely on PEMA's experience to make the determinations to close the recycling center and issues of a public health nature.
Thank you very much. Deputy, question for you.
Go ahead.
When folks are out and about, they want to get out and get that walk, get that public moment of at least briskly moving through fresh air without coming in contact with other people. What can they be doing with their kids in stay socially distant? How do they get their families out and moving?
Well, you could take it. We've talked about this before. So the family, that familiar unit that we talk about in our meetings, is fine. You can take your kids out with you. They can go on the same nature walk that you can. Obviously, if you're a parent and your children are young, they're going to be next to you anyways. So you can take them on the same walk. You can do fun activities at home, play in the yard. I don't see how anything changes within the home unit of them having a good time. Find some activities at the house to do, keep them occupied that way. Obviously, they're coming up with some type of schooling where they have to kind of do that. It's going to take up some hours. But yeah, going out for a walk is fine. You just need to stay away from other people if they're not within your family. That's the social distancing part. If there's a large crowd and you see that, work your way away from that, go somewhere else. The woods is big. Trails are big, so you can find a place to go.
Thank you. So anyone who has a question right now can reach out to the panelists through emailing pembrokeinfo@pactv.org. Julie, do you have any questions in? Did you have any related questions?
I do, Sabrina, thank you. And probably a number of you can answer these. Dan Trabucco, I assume you'll be one of the primary answers of this. So as it stands right now, the situation we're in is through May 4th. best case scenario, May 4th comes and we're open again. That means schools open and sports is open and we have to have elections and there's all kinds of things that suddenly are going to be able to be brought forward again. Is there a plan for a strategically kind of bringing things online one at a time versus everything opening at once?
Well, as you know, everything is still fluid right now. There are decisions being made on the federal and state level that have a direct impact on the local level that change almost day to day. I'll give you an example. The legislature right now is debating on whether to change the rules of town meetings and elections. How far can they be pushed back? And of course, the stopping point is the fiscal year. July 1st is the fiscal year for cities and towns. So no town meeting and election can happen after that. The legislature right now is debating on whether to allow towns to push back the fiscal year beyond July 1st to allow elections and town meetings to happen when things are safe. And with that comes a whole financial issue that is the crux of the problem, because the towns can't push their town budget into the next fiscal year. So there's quite a bit of a debate about that. But that's one thing that's fluid right now. So the Board of Selectmen can't make solid decisions on a lot of things until the federal and state government give us clear direction. But to your point of, will we have a plan? That's something that the Board of Selectmen will be talking about at this coming Tuesday's Board of Selectmen's meeting. And, you know, the Board of Selectmen, town manager, along with PEMA, will all need to be in concert in the school committee. We'll all need to be in concert when these things start to open. And I don't know that they're all going to open automatically on May 4th. That's the date right now. But as I said, it's fluid. We will work on a plan, and hopefully we can get solid information from the federal and state government to make smart decisions.
Thank you.
Thank you. One of the many things, Julie, to your point and to Dan's point, that we're waiting for from the legislature is land use permits, hearings, statutory automatic passes if certain dates go by. And that's something else that they're working on, and hopefully we'll have an answer on today. So to Mr. Trabucco's point, anything can change on any given day. And that's something emergency management has mentioned to folks as they update the website. The town website at www.pembroke-ma.gov has a COVID page that is launched through a red urgent alert banner. And we're working this week, and hopefully by Friday, close of business, we'll have a new look to that page, so that some of the data that's cluttering it, that's coming in daily, changes that affect government, changes that affect unemployment, changes that affect small business, will come off the main update and go into fly-up pages. So what stays true on the update page under a state of emergency is PEMA's message, and everything else will build out from there. So in the interests of trying to keep it relevant, pithy, simple, we're going to have to reconstruct it a little bit, because as the event goes on, the duration changes and the messaging changes. Question for Lisa. If people were going to go about some of their most normal activities and base activities, but still follow under the stay-at-home advisory, what are some of the most common things you're seeing happening in people's homes as reported through your conversations, your going around and speaking and talking to different people?
Sure. Most people are trying to focus on their children and education and having fun with the kids and doing things with the kids. My social media, my friends with younger children, seem to be doing some lessons, a lot of arts and crafts, a lot of cooking and baking with kids, which is an awesome idea. I know some people are tackling that home clean up, clean out, closet project. A lot of people are KonMariing or minimalizing rooms or closets or aspects of the home, the thing you never have time to do. Those are excellent uses of time. Some people are doing a lot of painting projects, not full on remodeling projects, of course, but freshening up, brightening up different rooms in the house that they normally wouldn't have time to do. A lot of people are working from home very successfully. A lot of my friends that are in different fields are working from home. People that have never worked from home before. So that's really nice to see that a lot of businesses are trying to work with a lot of people to keep them employed. And then when it comes to the outside activities, I'm still seeing, or at least in my immediate neighborhood, a lot of people are getting outside. I'm seeing more people walk, run, jog, bike than I ever have before. I'm seeing dogs get walked that have never been walked before. People are making excellent use of the outside area around the cranberry bogs. The town forest. There's a multitude of places to go walk. I believe that the deputy chief alluded to that before. The only thing you don't want to do is you don't want to gather in a group. You don't want to walk, 6 wide down the road next to each other. That's not wise for a multitude of reasons. You don't want to be gathering in a group or a clump. You want to spread out as you do this. But I'm seeing parents riding bikes with kids, people out walking dogs, people out doing all kinds of things like that. So that's the activities I'm seeing, and those activities are all safe. Those are all an excellent use of time. And an excellent use of our natural resources here in Pembroke to enjoy them.
Thank you. Follow up to that, sorry.
No problem.
We heard Tuesday from the Council on Aging Director that some of our seniors are feeling isolated.
Yes.
They need to stay out of the general population at this time. Thoughts, recommendations, suggestions for how to connect distantly but yet meaningfully with some of our seniors?
Absolutely. If you have a senior neighbor and you want to go say hi outside the window, or maybe the kids want to make some sort of craft or project or card message, something to leave on their doorstep for them, that's lovely. If you're making large meals and you're doing all this baking, that's an excellent thing too, to drop off a bag of cookies or a wrapped up plated meal for a senior that might be alone. And then the technology is awesome, and despite what some people think, there's a lot more seniors using technology now than ever before. FaceTime is one of the most popular ones, and not just seniors you don't know. Remember, grandparents, parents, families, FaceTime. Take time to have that picture interaction with your senior friends. A lot more seniors are on social media than ever before. Contact them through social media. I love it that my friends are sharing all those projects, the arts and crafts, the baking, and everything else they're doing with their kids. Because some of the stuff that these kids are doing and these parents are doing with them is just absolutely mind blowing, and it inspires others to do the same thing. So I'm seeing a lot of that too. But whenever you can share those moments, or the end product, or even a hello with a senior is always a wonderful thing. Again, you don't want face-to-face contact, but certainly dropping them off a little. I was thinking of you, maybe if you're going to the grocery store and they need a couple things and it's not a challenge for you to grab those items and leave it on a bag on their doorstep for them. That's a wonderful thing to do, and it helps keep them engaged with the people around them, and that's a real help.
So we are getting some more questions in. Julie, can you help out with that?
Yeah, I have one that came in, and actually it's come in from all 3 of our towns so far. Has there been a consideration of extending the school year so that the students actually had a full year? And I don't know who can answer that, and all of our towns, people have asked that question.
If you don't mind, I'd love to at least recap what Aranobi School Superintendent told us Tuesday. Now, I'm sure she's invited back for this upcoming Tuesday. We'll see if there's more clarification, because as Selectman Trabucco pointed out, it's very fluid. But she stated right now the plan is to end the school year at the June 19th date, when they've hit their 180 days in. But they're offering services, and they're working closely with some of your, I don't want to say juniors and seniors, because some of the high school kids who are tracking in a different way, they have expectations for their fall semesters or fall expectations, and they don't want to miss their beat. And some of these standardized tests have been moved. So she didn't indicate that was on the table at this point, but school committee is also meeting Tuesday. So she may have more information when she comes back in on Tuesday of next week.
Okay, and the only other thing I have is, can you talk about the wonderful highlights, the good stuff, the silver linings that are going on that you're seeing in Pembroke?
I was just going to say, Deputy, what are you seeing? Are you doing any drive-bys lately?
We are. We've actually we've started to put a little bit of joy and smiles on people's faces. So we're doing some birthday party drive-bys with the police department. We started Sunday, I believe, or Saturday of last week. Case by case as they come in. Obviously, if we're busy, we're going to have to put them off, but we're given options to time slots to try to move it around. If we are busy. Unfortunately, the next 2 weeks are going to be critical for us. So as those calls start to come in, if they do come in when we hit that peak, we may have to stop that particular event that we're doing. But so far, it's received really well online, and it's good. I mean, people are happy, people are out smiling, so that's what we're here for.
Lisa, what are you hearing out in the community regarding these silver lining moments?
Sure. A lot more people are outside. Whether you want to call it exercise or quality time with family or pets, that's awesome to see. And I'm seeing tenfold of that I ever used to see. So that's great. And we are seeing neighbors look out for each other. Certainly the neighbors on my street are talking more now than we ever have. Granted, we're yelling across the road at each other, but nonetheless, people are looking out for each other. People are offering things that they have surplus of to their neighbors who might be running short of, cleaning supplies, toilet paper, paper towels. I've seen people looking out for other seniors. That's really important. Checking on them. I've seen a lot of people taking care of their more senior family members. If they drop off something, they take care of the shopping for them. That's really nice to see. And then the little gifts and things from neighbors to others. I've seen some of that in my own neighborhood as well, whether it's just a card or a little something. And then online, you see a lot of people checking up online, posting happy and funny news to just help pick up spirits a little bit. And that's really nice to see.
When we heard about the call for greeting cards to go out with Meals on Wheels deliveries, we knew we had something special going on, and that was really nice.
Yeah, it is.
All right, Julie, what do you have for us as we close this up?
We just really have, there's one other question is, if people want to volunteer for anything, is there one specific place that they could go? Is there anything on the town website where they can sign up for volunteer activities and what is okay and what isn't?
Well, that's actually been coming up in the morning briefings. Go ahead, Lisa.
So I do know that the Treasurer Collector's Office is trying to organize some sort of a fun activity that people can participate in remotely for Easter. So please be on the lookout for that when we work out the details. But also, if people are looking for something to do, the blood shortage. I was reached out to personally. I'm a regular donor for the Red Cross. They're really desperate, and I mean desperate, for people to donate. Now, you cannot walk in for safety reasons and a bunch of others. They're really controlling the flow of people to keep people separate. But if you're looking to do something, I was very saddened to hear where the Red Cross is positioned versus what the need is going to look like in the next couple of weeks. It was absolutely heartbreaking. And so I've never called to confirm one of my appointments or had them call me where they asked me, do you know anyone else that can possibly come? Is there anyone else that you know? And I'm like, wow, okay. And they anticipate they only had 10 to 15% of what the need is going to be like over the next couple of weeks. So if people are really looking to help out, please get on your American Red Cross website, check out if any of the local hospitals, I'm probably going to guess most of the hospitals are dialing back that because it's a voluntary thing and they're going to be focused on ill patients. But please jump on the Red Cross website if you are able to donate and you can find a time slot in an area that's near you and go donate. That is so very important. The need is going to be enormous over the next couple of weeks, and it'd be a shame if a shortage of blood led to more loss of life than necessary.
And as a follow-up, Lisa, sorry to jump in here, but
No problem.
what about the grab and go at the food pantry? They're getting in far more tonnage than they ever have before.
And it's awesome. I was actually able to go by to the bonus. There's a bonus grab and go on Saturday that was absolutely awesome. Representative Cutler has been getting other sourced food, not just the food bank food that the pantry normally offers, where their grab and go is on a Thursday. So they've been doing a supplemental grab and go on Saturdays, and most of that is perishables. So by the, I don't know, halfway point, maybe a little after on that, on the perishables, they opened it up to everybody. So this is really important. Obviously, they're taking care of the people that have needs first, which is super important. But if the volume of perishables exceeds what the need is of the group that truly needs the support, then they open up to everyone. These are perishables. They need to go. And as I posted on Facebook, the perishables must go. Better for those perishables that may have been in a supermarket, maybe they were in a restaurant, better for them to be eaten than be thrown out. So there's been donations of perishables. So be on the lookout for that. And if the perishables exceed the need of those that are in need in the community, that's going to be opened up to everybody. So I was actually able to grab some perishables there. I was actually able to bring in one container of toilet paper for somebody that got lucky, but I was also able to grab some perishables for someone else that couldn't, because they have a medical limitation that prohibited them from participating. So I was able to drop that off to their home. So that was really awesome. So be on the lookout for those things, and then think about those seniors and those others that can't be at those events. And maybe if you can pick up something for them, that's a really nice thing to do.
Julie, do you have anything else before we go around for last words?
No, it would be great to get just a last word of advice from everyone until we see you again next Tuesday.
I know. I want to start with Lieutenant MacDonald. Sir, what are you hoping for in this town in the next week and in the weeks to come, prior to any uptick in activity or surge, calls you may get?
Just to continue to be kind to each other, take care of one another, care about your neighbor, and help out whenever you can and however you can.
Excellent. Deputy, what would you like to say to everybody?
Yeah, the same thing. I mean, the town's doing awesome with everything they're being asked to accomplish. So just keep up the good work, and just remember the next 2 weeks are going to be extremely important, that we social distance and stay inside, and then hopefully we can beat this and mitigate it and get it moved on.
Dan, if you were going to talk to everybody in your town, what would you be saying to them right now as they go into the next couple weeks?
Well, I would say the town of Pembroke government is functioning and functioning well. So the administrative aspects are all up and running. The public can't enter town hall, but people that work in town hall are there either directly or remotely. And for the people that work at the town hall, should know, whether you're in town hall or working from home, everyone is working and will continue to work. We are not having any furloughs. Everyone is going to be in place. It's an essential service, the town government. And also the Board of Selectmen are there and working, but we do rely in these instances on PEMA. We rely on the experts, the police, the fire, the Board of Health. So just know that the people that need to be in charge of the minutia and the day-to-day events is PEMA, but Town of Pembroke government is up and running.
Thank you. And Lisa, as we say goodbye and get out and move on to your next call, which of course is the way your days are rolling these lately.
Yes.
What can people do, and what should they take away as the most positive aspects of this? What should they be looking for in the days to come? And what is your guidance? What is your recommendation?
Always wash your hands. Everyone gets tired of hearing me say that, but it really is the best way to safeguard yourself. If you're going to be out in going to the supermarket or anywhere else you need to go, obviously only go where you need to go. The last thing I'd like to leave everyone with is try to be positive. And it is hard, and you are going to have frustrating moments. I'm having frustrating moments. And when you have a frustrating moment, take a deep breath, take a walk. Maybe you take a bath and relax a little bit. Maybe you take a nap. I don't know what you do, but whatever it is you do to help reset yourself, do that. Take moments for yourself. If you're a mom with 3 kids at home, take a moment for yourself when dad's around, because staying positive is not only a mental thing of how to beat this, it's also physical. When you get worn down and your body gets worn down and you get feeling not so good, it makes your body more susceptible to actual physical maladies. So try to stay positive. This too shall pass. It could be worse. We are doing better than I honestly thought we were going to be doing at this point, and I'm going to knock on wood. that we continue to be tracking better than some communities and some countries have fared. So, stay positive and take time and make sure you keep that positive attitude. This too will pass.
Thank you, Lisa. And the data does show that taking these measures minimizes the town's exposure and risk and it keeps its citizens
Absolutely.
and residents healthier. Thank you very much, everybody. I really appreciate you taking the time out of your day this morning. We're going to do this again in this particular format on Thursday of next week. On Tuesday, we can expect to see more information from the school superintendent, from the Council on Aging Director, and we're reaching out to get a couple of members in the business community to join as well with Representative Cutler to start talking about the things that people are concerned with regarding their mortgages, their rent, their unemployment needs. Maybe they're a small business, maybe they're a sole proprietor. What are they going to do as life changes for them over the next few weeks? So thank you very much, everybody, and we'll see you next week.
Thank you.
Thank you.
Thank you.
Thank you very much. Julie?
Thank you, Sabrina, very much. And again, you can see the replay of this at pactv.org/Pembroke. We are here every Tuesday and Thursday at 9 a.m. Please do visit the Pembroke Town website, which is updated daily. Just click on that big red banner right in the middle and you'll get daily updates. Thanks so much, Sabrina, for being the coordinator of this every single Tuesday and Thursday. And we will see you soon. Stay safe, stay positive, be kind.